Okay, good morning, everybody. My name is Mark Merrick. I'm here with Todd Archer. I'm a independent insurance agent in Texas, member of the Independent Insurance Agents of San Antonio. I specialize in health insurance, and I have Todd Archer here with me. We're going to go through just a series of questions to kind of give everybody mainly a focus we want to give everybody is give you enough information that it urges you or gives you enough information that you feel that you can ask your customers about health insurance and hopefully generate some business for yourselves and for your agency. So without further ado, Todd, as I mentioned, is with Assured Benefit Administrators. Are an independent benefit administration firm out of Dallas. They are Texas-based, and so they handle health insurance and employee benefits for all sizes of organizations, both public and private. I think the minimum y'all have at this point, Todd, is pretty much 5 members.
That's correct.
So that's what they handle. So first question is, Todd, when is the best time to ask about health insurance?
Well, Mark, generally you want to start discussing health insurance with employers basically about 6 months or so before their renewal date. You know, a preponderance, particularly of the small employers, they're going to renew 12/1 and 1/1. They almost were exclusively 1/1 until the ACA passed, in which case a big chunk of that business actually starts renewing 12/1. But you want to get out there in that June, July, even August time frame. Because if you wait until the end of the year till they actually get the renewal, then you're going to start bumping up against all the background noise around the year end for the employer. And then there's that pressure of trying to get something done for the renewal, in time for the renewal, and oftentimes that's going to trump what might be a better solution that you're able to put on the table for them.
Okay, understood. And what's the markets for health insurance?
Well, you know, in the health insurance, the markets are basically twofold, right? You've got your fully insured market, and then you've got your self-insured market. Now, the players in that market are some the same, some different, okay? On the fully insured side, certainly you've got what I refer to as the BUCAs, right? The Blues, United, Cigna, and Aetna. And then occasionally, in some markets, you're going to have some local health plans that are almost exclusively owned by health systems in that specific market. So on the fully insured side of the coin, that's what you're going to be looking at. On the self-insured side, there you're going to get, again, the BUCAs that are going to be playing in the administrative services only or an ASO environment where they're just acting as a TPA, not as a carrier. Then you're going to have BUCA-owned TPAs because they also have TPAs that they've bought, like Meritane's owned by Aetna, UMR, and HealthScope are owned by United Healthcare, and you've got Caprock, who's owned by the Blues of Alabama. And then you're also going to have TPAs that are owned by private equity, and the two biggest names that are playing in that space are EBMS, Group and Pension, and so those are the two biggest names you'll hear that are going to be basically owned by private equity. And then you're going to have TPAs like ABA that are independently owned and are locally owned and operated. So those are basically the markets and the players in those markets.
Okay. And then what is the role of the independent insurance agent? What do you all, I mean, as far as, you know, obviously all the independent agents have, you know, we're talking to everybody here who's involved in running, either managing an agency, they have P&C business, et cetera. So what do you all expect as the administrator of the plan? What do you all expect independent agents to do for you?
Sure. So, you know, the first thing I think is important is, one, health insurance in our country is delivered at a local level. And therefore, having someone that understands the nuances of that local market can really deliver real value to an employer. Most of the big brokerage firms, they have local offices, but the decisions are almost always made somewhere else. They're not made there locally, right? And so being local, privately owned, allows the independent agent to kind of put their clients first. And that doesn't often happen at firms that are owned by Wall Street or by private equity or that are part of a conglomerate with a lot of competing priorities. So in an industry that's full of misaligned incentives, to us, the independent agents are different. And so really what we want them to be is to be our feet on the ground, to help us understand what needs to happen, what the risks are there, and then how we can best serve the needs of you and the client.
Okay. And the other question is, what's the role of the third-party administrator in the health insurance market? What is your role?
So, our role as an independent administrator is much like, so we're kind of kindred spirits, if you will, to the independent insurance agents in that regard. So in addition to the nature of the relationship, of our relationship with the employer lends itself to a higher degree of accountability. So if you think about it, if you ask an employer that's with one of the BUCAs, do they work for you? The answer to that question is mostly going to be no, or something worse than that, right? Whereas the relationship a TPA, an independent TPA, has with an employer is a direct relationship, and it's so real clear who works for who. And to me, that has both service enhancement consequences, as well as a higher degree of accountability, because we understand from the get-go, we understand that money's never our money, it's the employer's money, and that just lends itself to a higher degree of accountability, which generally is going to result in better results for the employer.
Understood. And how is the health insurance market underwritten? What's the underwriting process?
Right. So, certainly in a larger group context, those are underwritten, they're experience underwritten by the employer. So we just need demographic data, a couple of years of experience information, and then a census, obviously, and a schedule of benefits. And then that's going to be underwritten. On the smaller group side, there it gets a little nuanced, because really on the fully insured side, those are all going to be community rated, and it's pretty much just going to be basically a big pooled rate that everybody's going to participate in. On a level funded environment for small employers, there we still have the ability to do medical underwriting. And so what happens is oftentimes you'll see a group that's been fully insured, they may have a rate that is reflective of some prior poor experience that the carrier has had. And so when you get a medically underwritten group, oftentimes you'll get a 30 to 40% reduction in premium based on the risk that exists in that group today. But the problem is, if you're using experience rated, which honestly most of the larger brokerage firms, they do not want to do medical underwriting. They only want to use experience underwriting. But if you get a group that's experienced underwriting, and the risk that's there today actually results in a 30 to 40% rate increase, most carriers are not going to reduce their rates below current that far. So there's always an element of shadow pricing that's going to occur in that experience rating. When you go on apps and you're strictly pricing based on the risk that's present in the group, you can get 30 to 40% reduction in costs. Now, the big reluctance there's been out there is, getting medical apps on a lot of employees sometimes gets a little messy, but honestly, technology is catching up. Now you can do that through digital platforms that make it very easy to distribute the forms, collect them, scrub them, and then process the applications and streamline the process. And so getting the applications is easier and can lead to significant savings on those low to medium risk groups. And so to us, that's where the big difference is, and that's where it can pay off for the independent agents that are willing to do that process and deliver a better rate and experience for their client.
Yeah, so an important point to emphasize is that the independent agent doesn't have to handhold and spend a inordinate amount of time in gathering all the applications and the data for ABA to be able to underwrite the group.
That's correct. We use a platform called EHealth Apps that basically can manage that process for you. And we do absorb the cost of that for the groups that you place with ABA.
Super, super. And so once the plan is underwritten, how much involvement does the independent agent have to have with the group?
Well, you've seen one of those arrangements, you've seen one of those arrangements, right? So each agent's going to be a little different, right? Some of them take a very much a hands-on approach to that. Some of them don't. And so at the end of the day, that's where working with an independent TPA, we're able to customize our service model to accommodate the way the independent agent wishes to run his block of business.
Super, super. Okay, well, that's thanks a lot, Todd, and thanks a lot for your time, and thanks for the information.